Can you imagine spending $15 billion to change your appearance? That's what almost 12 million people did just last year alone. And that figure is huge, right? That figure is shocking. But what shocked me even more is the amount of surgeries that go terribly wrong. When Jennifer decided to get breast implants 5 years ago, she never dreamed that the surgery would end in a nightmare.
When they tell you that there could be complications, they don't tell you that you might have to walk around with one breast.
Joining us today is board-certified plastic surgeon Dr. J. Calvert. Dr. Calvert, have you heard of these type of botched surgeries where it's horrific?
Absolutely. I mean,
Like
these are the extreme complications that are very rare. They are part of the informed consent that Jennifer seems to have missed when she was learning about her surgery. That would make people sort of take pause and say, well, what does that translate into? I can tell you that there are operations that can be done to make things better. I don't think you'll ever be back to where you were, but I've done a fair amount of breast reconstruction, and I've seen cases much worse, and I've been able to help those patients through those situations. So I'm offering you my help to get you through this situation now.
Thank you so much.
Somebody that really knows what he's doing, that really knows and says that he can get you on a better path.
Dr. Calvert and his staff worked carefully to give Jennifer the new body she's been waiting for the past 6 years. After 4 hours of arduous surgery, the operation is a success.
She's got a great result, and she should be very happy.
Dr. Calvert shares the results with Jennifer's fiancé, Mike.
It looks pretty good. There was some fluid in there that has me just a little bit concerned, but overall, I mean, the result right now just is beautiful. She's going to be really happy.
And a groggy Jennifer who promptly shares her gratitude with the doctor and his staff.
How you making out?
Good. Well, great.
Thank
Real
you
happy.
so much.
Oh, you're so welcome. Don't cry again. You're going to make me cry again.
I'm trying. You always have a special place in my heart.
Looks great. I think
What size am I?
Depends on, you know, whose bras you're buying.
Bras I'm wearing.
Jennifer, what condition were your breasts in the last time that you were here?
I pretty much had absolutely nothing left. I basically had like a mastectomy. That's really where I was.
And what was the consultation like with Dr. Calvert? Because I know that we surprised you with a you know, a
Yeah.
nice free surgery from
Yes.
Dr. Calvert.
No, it was great. When I met him, he was so confident that he could help me. He had so much confidence.
Because he knew
in
what the
it.
heck he was doing.
Yes.
Yeah. Dr. Calvert is joining us now. You got me all teary-eyed over here. So, Dr. Calvert, how did the surgery go? 4 hours, is that a long time? That seems like a long time.
For breast reconstruction, it's a bit longer. It was a very difficult operation. You know, we saw how things looked before, and we really had a lot of work to do just to undo all the scarring and damage that was there.
Thank you so much,
Yes.
Dr. Calvert. Thank you.
My pleasure.